So I bring greetings from my colleagues, especially those of them that work very hard in controlling the ongoing yellow fever outbreak, and also to ensure that Nigeria achieve the eliminating yellow fever, the eliminating yellow fever epidemic strategy. So Nigeria Center for Disease Control is coordinating with other agencies the control of yellow fever in Nigeria. So as a form of outline, I will be talking briefly about yellow fever, the history of yellow fever in Nigeria. I will also give a summary of the ongoing outbreak, and also lay little emphasis on the Edo State outbreak and the use of molecular diagnostics. And then I'll talk about the challenges and some of the recommendations that we have. So yellow fever outbreak has been ongoing for centuries. The earliest documented outbreak in Nigeria was as far back as 1864. And we've had other major outbreaks, 1969, 1986, 1995. Actually, the 1986 outbreak actually set the pace for establishing a surveillance system, a national surveillance system in Nigeria, because there were quite large number of cases and deaths in hundreds of thousands. Now, the current outbreak started in September 2017, and this actually happened to be at the same time that we had the re-emergence of monkeypox in Nigeria. So we had two re-emergence of two different diseases at the same time, yellow fever and monkeypox. And yellow fever in Nigeria is for immediate reporting, so which means it is reported weekly, and for immediate reporting, and also even for zero reporting on weekly basis. And for investigation of yellow fever cases is done by case-based surveillance system. Now we have Nigeria happened to be on the list of high priority countries on the high strategy, and the implementation of the preventive mass vaccination campaign was started in 2013 in Nigeria, which was implemented actually in 3 states, but it wasn't concluded because of due to the non-availability of sufficient vaccine at that time. So the current outbreak, 2017-2018 outbreak ongoing in Nigeria, like I said, was a re-emergence, and the outbreak is active currently. So we could see from 2017, September, to 2019, with the outbreak is ongoing, but very much under control. So in all, between September 2017 and now, we've been able to record between September 2017 and December 2018, beg your pardon, we've recorded about 4,100 suspected cases in 36 states. That means all states in Nigeria have reported suspected cases of yellow fever. And we've been able to investigate with sample collection and laboratory investigation 3,800 cases. In country, we've been able to we're able to do the presumptive confirmation of 237 cases, out of which 139 of these were confirmed at the regional lab in Dakar. Now, we have recorded 80 deaths among all reported cases, out of which 29 of them were in confirmed cases, giving us a case fatality rate of 21%. Now, the most affected state happened to be Edo State, which recorded more than 50% of the confirmed cases. So we have here the map of Nigeria showing us. We could see the yellow map showing us that we have suspected cases of yellow fever in all states. However, we have 17 states out of the 36 plus 1 states, plus 1 means the Federal Capital Territory. We've had 17 of them with confirmed cases. Now, so this line graph showing us the distribution of these cases from 2017 September till 2018 December, and we could see that there has been the cases have been well spread throughout this period. So we seem to, the outbreak has been ongoing. We know that in Nigeria we have the conditions are favorable for transmission because we have the vectors present. Actually, all the states affected, we've been able to confirm the presence of the vector transmitting this disease. And we know that the urban, the population of the country also supports the transmission of this. Now, a bit in detail, what happened in Edo State? In November 2018, about over a year after the onset of the outbreak, Edo State Ministry of Health reported to the NCDC some unusual deaths and illnesses in their communities. You know, Edo State, from a previous presentation from Nigeria, you will know, happened to be the epicenter for Lassa fever in Nigeria. And these cases were presenting with viral hemorrhagic-like symptoms, including bleeding. So many of these cases were actually taken to be suspected Lassa fever cases. The samples were taken for this patient and were tested for Lassa fever, but they came up negative for Lassa fever, which prompted the need to test further for yellow fever. So the interesting thing about this is that we have these samples were sent to non-network lab. We have 4 laboratories in Nigeria that are accredited for testing of yellow fever, but these samples were sent to molecular labs, which were not included, are not part of the yellow fever network lab. And these samples, the lab were able to confirm the yellow fever in the samples that were tested. So investigation review the outbreak has started actually from September, but was reported in November. So we have late the outbreak was actually detected quite late. So but the actions that were taken on discovering that we have actually yellow fever outbreak in Edo State, so we have to send, the NCDC sent a rapid response team to Edo State to support investigation. We have the healthcare workers and community sensitization done. This was not done just by NCDC alone. This was done in collaboration with other agencies. We have entomological studies done led by the National Arbovirus Research Center in Enugu State in Nigeria, and then we have a request was made for ICG to ensure a vaccination campaign done. Now, I will need to emphasize the strong collaboration between the NCDC and the vaccination agency, which is the Nigerian Primary Healthcare Development Agency, the agency responsible for vaccination program in Nigeria. So NCDC collaborated with MPACDA and then the entomology agency to carry out the investigation and response to the outbreak. So within less than 1 month of the onset of confirmation of the outbreak, reactive vaccination was carried out in Edo State, and a total of 1,738,000 people were vaccinated, giving us over 100% vaccination coverage. Now, so for the general response to the yellow fever outbreak in Nigeria, we have our strategy has to do, we have advocacy, active surveillance, the EOC, Emergency Operations Center was activated both at the national level and at the state level. And we have our clinicians that were trained for case management and those supportive. And the risk communication was an important part of the response, which was done. You could see from the pictures, we'll see members of our team going house to house, going to into the communities, into worship houses, to be able to sensitize people on the need to protect themselves against yellow fever. The vaccination was done. And like mentioned earlier, we have the etymological study that was done in all the affected communities. So I'm talking about the preventive mass vaccination campaign. Like I mentioned earlier, the first set was done in 2013. So during this outbreak, we have to ensure that the phased vaccination campaign commenced, giving priorities to the states where there was active outbreak. So as at now, we've been able to complete the second phase of the vaccination campaign, and 12 states have been have completed this campaign. The second phase of this will take on early in this 2019, concluding the whole campaign by 2021. So I would now want to go a bit into detail regarding the national Nigerian National Laboratory Network for Yellow Fever. Like I mentioned, we have just four laboratories throughout the country that are accredited for yellow fever, and this is done actually by serology. So the four are located in 3 state labs and 1 of our national laboratory in Lagos. Now, so the NCDC, in collaboration with WHO, we aim to expand the yellow fever network, and an assessment was done. It starts in some selected laboratory across the country to be able to select some more laboratory to join the testing laboratory to lessen the burden on these few laboratories. So with these 3 more laboratories have been identified, which we have the National Reference Lab in Abuja, in Benin City, and another in Enugu to join the network of labs that are testing using serology. In addition to this, we're also expanding to include molecular laboratory in the testing. Now, the challenges and the limitations that we are currently facing, we know that the testing is by serology, and you know the current protocol takes 48 to 72 hours to be able to carry out a single test, and we know that these positive samples will have to be shipped to HIPDACAL, the regional reference lab, for confirmation. So currently, in country, we are unable to make a confirmation for yellow fever, and that means until we've been able to do that from the regional reference lab, we are unable to commence response, especially when we have to do reactive vaccination during the outbreak. Now, so the analysis that have been done by our team has shown that on the outbreak, we'll need 21 days to be able to get confirmation done for yellow fever, and this will cause a lot of delay in response. So the case in Edo State has shown to us, if we are able to do molecular testing, which is faster, within 2 hours we'll be able to get a test done. This can lessen the duration of the time, and it can also help us to be able to respond adequately and in good time. Now we have, so we are not unaware of challenges that may be associated with the use of the molecular testing, PCR. So we are taking all this into consideration. We currently have some limitation in terms of accepting results from our molecular testing lab, because usually our labs which test for Lassa fever some of them have capacity to test for other VHFs, including yellow fever. But because these labs are not included in the network of yellow fever testing lab, it sometimes could be a bit challenging accepting the results from these other laboratories. So presently, we're working very hard to see how they can be incorporated into the testing laboratory. So our next step, we want to operationalize the network expansion, including from 4 to 7, and then the 5 molecular testing laboratories that we currently have that we also want them to be registered to be able to carry out tests, yellow fever tests. Now, we are careful to integrate this molecular lab into the network of labs. Then we also want to strengthen it's important to strengthen the serological testing capacity to be able to shorten this testing duration from 48 to 72 hours to ensure that we are able to get the turnaround time for results is shortened. Then like I mentioned, we need to send sample to IP-Dakar. It is important for us to be able to ensure that one of our national reference laboratory is accredited by WHO in order for us to be able to confirm yellow fever outbreak in country. Improvement in sample transportation from states to the national, to the testing laboratory is another area that we really we're working on and need support. So in conclusion, we say the NCDC is in collaboration with other agencies and partners, is committed to the eliminating yellow fever epidemic. And we want to strengthen the surveillance system to be able to detect cases earlier and continue, and then we will need continued support, financial and advocacy, to be able to assist the country in strengthening the laboratory network that exists and the one that we really want them to incorporate to be able to ensure that we have real-time case confirmation. Funding is needed to support procurement of reagents. Like you could see, we have over 4,000 samples. All these samples are meant to be tested, so a lot of support is also needed in funding procurement of reagents, both for the molecular and the serological testing. Now, very important for us is for us to be able to get a national, a WHO accredited lab in country that can ensure confirmation of our samples without having to send sample out of the country. So we acknowledge the support of our partners and sister agencies in the control of yellow fever in Nigeria. Thank you very much.